Of paramount importance when addressing the House, the topic at hand, not only to emphasize matters pertaining to youth, but also to make reference to the enslavement of youth and the murder of innocents. I make special note of narcotics, reckless use of medical drugs, inappropriate use of domestically used substances which contain chemical compounds that intoxicate, and of course, the age-old enemies which are alcohol and tobacco. Mr. Deputy Chairman, I want to state at the outset that the NATA Act came into force in 2006. It is a result of the wisdom of the Mahinda Chintana, which bequeathed to our society its offspring, Matata Tita, or a full stop to intoxicants. The Act itself is laudable, and especially President Rajapaksa's role in bringing it forward, and also the present Health Minister's tireless efforts to protect the general population can be termed as admirable. The international conspirators, however, that come in the form of British American tobacco and their local proxies here have resorted to sheer deviousness to avoid the consequences they are legally, socially, and morally bound by. Research done by reliable organizations committed to protecting youth and society in our country, such as Healthy Lanka and FISD, point out that from each village, the average amount of money spent on alcohol and tobacco is 10 million per year. This has been based on the legally declared income of the alcohol and tobacco industry together as per annum and divided by the Grama Niladhari divisions in this country. This roughly works out to 100 people of each Grama Niladhari division smoking 5 cigarettes a day. Any person engaged in ground-level politics will understand, any person who's engaged with interaction with people will understand that these figures are conservative. They by no means overstate the issue. The survey also shows that 79% of vendors have sold cigarettes and alcohol to teenagers under the age of 21. This is entirely contrary to the act brought in by this government. The penalties for offenders, Mr. Deputy Chairman, is not nearly as sufficient when one considers the repercussions on society for such infringement. Based on the legally declared profits of alcohol and tobacco industries, every Grama Niladhari division spends 10 million rupees a year for these poisons. There are 149 such divisions coming under the electorate of Mirigama, which can accordingly be estimated as 1,490 million rupees per annum for perpetuation of these vices. In contrast, I, as a Member of Parliament, received, sir, 5 million rupees for development. This, sir, is the biggest obstacle we have for development in this country. Today, the Honourable Minister Sirisena is fighting his cause before the judiciary for attempting to introduce a warning pictorially depicting cancer, which the murderous cigarette and alcohol industry is directly responsible for. Today, there are 63 countries that have legally enforced this requirement as per the international treaty of the WHO known as the Framework Convention on Tobacco Control. It is an international obligation we must honour. Those that seek to abuse the judicial process to delay the implementation of such measures formulated to save the lives and health of Sri Lankans must also be prosecuted for the abuse of the legal process. I call upon the youth parliamentarians in particular and the Minister of Youth Affairs to partner with the Ministry of Health to defeat this scourge that has been as harmful to the social fabric as much as terrorism. Even in the colonial era, patriotic leaders, even like my great-grandfather, Right Honourable d.s.senanayeka, were imprisoned on false charges because he pioneered the temperance or Amadhyapa movement in this country. It is the same today. The tobacco and alcohol industry is filthy rich, rich from the filth that they prostitute before our youth and society.
Now, you have 1 more minute.
Mr. Deputy Speaker, the intention of Parliament is manifestly clear in Section 34, which requires that any party attempting to sell tobacco products must comply with the pictorial depiction of its dangers as required by both national and international law by virtue of the treaty we have entered into. And Section 34 states, a manufacturer of a tobacco product shall cause to be displayed conspicuously and easily legible print on every packet containing tobacco products manufactured by such manufacturer, a label of such dimensions as may be prescribed containing a statement of tar and nicotine content in each tobacco product in such market, and such health warnings as may be prescribed. Unquote. I emphasize again the last line, and such health warnings as may be prescribed. I shall conclude, although there's a lot more to say on this, that